The kind of cases that we do get here in mother and child, perhaps she would have been one of the unfortunate mortality statistics. And that is why a facility such as this place must be made available to everybody.
You're welcome. My name is Dr. Lawal Oyeneyin. I'm a consultant obstetrician and gynecologist and the pioneer chief medical director of the Mother and Child Hospital in Akure, Ondo State, in Nigeria. You're welcome to Inside Mother and Child, a program dedicated to giving an insight into activities at this facility, a purpose-built 100-bed facility catering for pregnant women and children under the age of 5 years, free of charge, towards reducing maternal and child deaths in Ondo State by running an integrated maternal and child care service fully poised to offer qualitative and critical intervention when required. At the moment, we're going to talk about issues relating to a societal dilemma, I must say, where you have women having unwanted pregnancies and the subsequent sequelae, and where the innocents sometimes are inadvertent victims. So stay tuned as we share with you a true life event that occurred at the Mother and Child Hospital.
I am Dr. Oluaegun. I'm a member of the National Youth Service Corps, a doctor working in Mother and Child. I'm working in the Department of Pediatrics as a medical officer. I was on call this evening when a child was brought in, about a day old, picked up by the wayside, wrapped in a bag. Baby was brought into the hospital by a policewoman.
You are the one that brought that child. I am not the one. Information get a lot from that contract. Okay, and the OC gave me the PC education. The woman is also there. Where is the child? Okay, the woman is serving me. Yeah? The police officer. I am the OC. No, the police officer who saw the video. I don't know the police officer. I just want to see him. Báwo ni wọ́n ní ó máa ṣeun gan God will bless you wọ́n ní wọ́n lórí ọmọ ní kò tó wá sí Mother and Child ó ga òǹkó ló ti rí ó ga o àwọn èèyàn burú níbo ló ti ń sáàbù wọ́n ní woman police yẹn A division ló wà ní mess kí lorúkọ ẹ. Dorothy Endurance ní inspector mess ṣọmọ tó ń sọ̀rọ̀ OCJWC àti Yẹmí ṣé wọ́n ní òkè wá bá mi lọ́fíìsì ó mọ̀ pé it is you ló lè fún wa ní information bó ṣe rí so that màá lè fi make entry ó dọ́fíìsì mi ò rí mi okay kó wá rí mi láàárọ̀ ọ̀la nìkan bíi 9 tó bàbá mi wà bá woman sergeant níbẹ̀ so that wọ́n á lè make entry tó mọ̀ pé bó ṣe rí yẹn la máa fi make report.
So, well, he said he was a policeman, and it was in his state. The child was dirty. You know, there was feces, fecal matter on the baby. The placenta was not separated from the baby, and it was smelling. The stench filled the whole room. When we examined the child, we found that it was alive. It was breathing. It still had most of the normal reflexes, but it was weak. And it had a lot of excoriations on the skin. Obviously, the child had been exposed for a long time. The skin was macerated and dirty. So we cleaned up the child. We set up intravenous access and dehydrated the child, gave dextrose to just give some energy. We've run some tests on the child, some basic tests. We've done a PCV, packed cell volume, to estimate the amount of blood that the child has presently, because it possibly could have lost a lot of blood and will need to be transfused. The PCV is low. Then we are also looking at the white cell counts, the total and differential counts, to show us if there is any infection in the bloodstream. Although the child is already on antibiotic cover, but we want to be sure that whatever is happening there, we are handling it appropriately. So that test will help us to make that decision. Then we're also doing serum electrolyte urine creatinine to help us determine the level of the level of electrolytes in the blood. If it's okay, if it needs to be corrected. Such things, due to the exposure the child has had, it has lost a lot of body electrolytes and fluids, and such things could tilt the child, to a state of health that is not desirable.
The child is at least 24 hours old, but that's the only way you can have this use. So we have to assume that it's at least 24 hours. So, but by God's grace, everything else is a week gone. So we have to give it.
We have put the child in an incubator now to maintain his temperature. Well, it's not improved, but time will tell how it's going to be. But in general, to speak, the experience is it's something horrible to think someone would abandon a child like that in a dirty place. Why maybe we should have facilities that care for children whose parents don't want them, instead of dumping a child to die and then having it picked up in that state. The child is exposed to so many things, possibly tetanus, anything, could just die. But thank God for mother and child hospital services like this that can cater to such children, because at least that child came here, got treated in time.
There you are, ladies and gentlemen, the possible sequelae of an unwanted pregnancy, as the footage showed. Now, we have no way of knowing the background that will lead a mother to abandon her child. But what comes to our mind is, whether we like it or not, issues related to unwanted pregnancies must be brought to the fore in our society. It is clear that women may be put in a position where they get pregnant and they are at a loss at what to do about it, especially if the pregnancy is unwanted. In the first place, we need to be clear that abstinence is the key to preventing any pregnancy. But we actually have some forms of contraception or family planning devices that can allow a woman, in fact a couple, to have children by choice and not by chance. And what we advise is, if you as a woman in the reproductive age group is in a situation where you're willing to have a relationship with a man, you're unwilling to abstain, know that you have a choice. That choice can vary between something as basic as a condom to pills to special intrauterine contraceptive devices. Whatever the case may be, there is a contraceptive device to fit every woman. And women are encouraged to visit family planning clinics or any healthcare professional, that is a doctor, nurse, or specially trained professionals that can answer your questions and advise appropriately. We need to be mindful that prevention, as far as unwanted pregnancies are concerned, is always better than the cure. I can imagine the psychological trauma the mother of that baby is probably going through now, the overwhelming guilt of having to discard a baby, a product of an unwanted pregnancy. Now, we're going to talk about the hazard of food poisoning as it concerns a family with 4 young children. Please stay tuned.
My name is Faith. Actually, about 3 weeks, close to a month now, we're formerly staying at Rakale. So when the dualization, the government dualized the road, we had to move. And when we moved to, I guess one of the reasons for the bad water, where we moved to is at Ijoka area. And where we're staying before, we were using tap water. And when we got there, we found ourselves using the well water. And so 3 weeks ago, the children all developed the same symptoms of stooling, vomiting, throwing up and all that. So we came to the clinic 3 days ago and we rushed them overnight. And they were suggesting that maybe it was food poisoning because of the same symptoms. And I also saw it to it because when I looked back at what they ate last and how the symptoms developed. So we also put it together that it had to do with the food and the bad water that they were taking. Because we discovered that when we got there, everybody was drinking the water. We tried finding out what their source of drinking water, and they said that that's what they've been using and it doesn't have problems and all that. We started taking it, but we're using water guard, but despite that, it caused a problem. And the 2 of them were discharged yesterday. So there remains remaining 2 on the bed now. This one and the other one. So for these 2, these 2 are the most critical cases. The other 2 had gone home yesterday. So maybe when the doctor comes this morning, or they are really responding to treatment. Actually, I didn't want to come to Mother and Child. I was looking at it with the eye of every government hospital. When people say government, I was like very skeptical because I believed everything government was. But when I got here, I got the best of treatment. I never expected it to be that, and I give the government kudos. They've really tried. What I have to say is, from what I saw outside, that the reason why this particular institution was built is to reduce mortality rates from women and children. And I will advise a lot of women, especially those that don't bother coming to the hospitals to give birth, those that don't bring their children for one reason or the other, that they should try patronizing government hospitals, or especially Mother and Child, because Mother and Child has been actually exceptional for what happened to my kids. I can always say it anywhere that they tried their best.
I'm Dr. Oyeneyin. I'm a medical officer at the Department of Pediatrics, that is the Children Department of the Mother and Child Hospital here in Akure. Our
patients came in this evening. They came into the emergency this evening with about 5 hours history of ingestion of kerosene.
My name is Bella Innocent. I'm come from Ebon State. So, you know, we were cooking in our practice. My neighbor want to wash our stove. Then he removed the rubber used to put inside the stove and keep it. So this baby just went to that place and drank the kerosene.
The patient had already presented in a private hospital where was told that there was no doctor on ground to attend to her. So she now went to the state specialist hospital where they presently they are having a renovation. They are renovating the hospital. So they have limited number of spaces to admit their pediatric patients. So the patient was subsequently referred to this place, and the mother told us that she had already given palm oil and the child had vomited after taking the kerosene, and this may even worsen the condition. The vomiting and the giving of palm oil may worsen the condition. But immediately they came in, we have started treating the child, and the child is getting better. But subsequently, we just want to implore mothers, we want to advise them that anytime such a thing happens, the child should be brought into the hospital immediately, instead of giving some medications, or instead of trying some things for them at home. The child should be brought into the hospital immediately, and mothers should try as much as possible not to put kerosene in containers that can attract children. Containers like Vijumi containers, like Ragolis water containers. So kerosene should be kept properly in kegs and should be taken away out of the reach of children.
Yes, you're welcome. Issues pertaining to food poisoning is again another danger that we need to know about. A case in point is a family with 4 children, and they were exposed to unclean water from the well in the compound where they live, and that in itself is a major risk factor for transfer of germs of various types to human beings. So we must advocate that parents and guardians should endeavor to just make sure that whatever it is, the kind of water or the kind of food that they're cooking or they're drinking at home should be clean and should be healthy. Believe me, it can save you a lot of grief. Children are not as constitutionally strong as adults, obviously, to withstand a load of germs. The case in point are these children who presented with symptoms of food poisoning, exemplified by excessive vomiting and diarrhea. Some of them actually developed a high temperature as well. We thank God that they were able to come here just in time, and they were able to be treated appropriately and have recovered. But I must tell you that one of the commonest causes of death in children under the age of 5 is excessive vomiting and diarrhea. And one of the commonest causes of excessive vomiting and diarrhea is the ingestion of unclean food, unclean water. So, food poisoning will definitely fit into that category. So please, again, I implore that let's make sure the water we consume at home is clean and the food we eat are well cooked. On that note, we would like to end this maiden edition of Inside Mother and Child. I hope we've made an impact as we strive to improve the health of mothers and children in Ondo State. Thank you very much.